Good evening everybody. In today's session we will discuss about chronic kidney disease and its association to pedal edema along with its causes, symptoms and treatment. First let us see what chronic kidney disease is. The continuing and permanent degeneration of the kidneys is known as chronic kidney disease. As we all know, the kidneys play a vital role in human body. They serve a variety of purposes including maintaining the body's mineral and electrolyte balance, assisting in the production of red blood cells, maintaining the acid-base balance of the blood, or excreting water-soluble waste. Kidneys that have been damaged or lose their capacity to excrete these functions. There are 5 stages of chronic kidney disease. In kidney stage 1, the kidneys are normal, where more than 90% of the kidneys are functioning properly. Whereas in stage 2, the kidneys are mildly decreased to 60 to 89% of their kidney functions. In CKD stage 3, the kidney functions decreases mild to moderate to about 30 to 59%. And in stage 4, the kidney functions are severely decreased to 15 to 29%. Finally, in the stage 5, there is a kidney failure and the percentage of kidney function is less than 15%. Since the kidneys can compensate for the lost functions, the signs and symptoms may not appear till the permanent damage has occurred. Some of the commonly observed CKD symptoms depend on the severity importantly are the swelling of the feet and the ankle, or what we commonly call as pedal edema. They may be associated with nausea, vomiting or loss of appetite. They may also be associated with sleep problems, difficulty in passing urine, diminished mental sharpness, muscle cramps, high blood pressure and breathing difficulty. As we looked at the signs and symptoms of CKD, one of the major symptom is pedal edema or the swollen sweet ankle. So let us see what this pedal edema is. Pedal edema is the swelling of the feet and the ankle caused by an abnormal buildup of the fluid in the ankle, feet or in the lower limbs. Edema of the feet can be caused by 2 different mechanisms and can happen unison or separately. So let us see how this pedal edema is linked to chronic kidney disease. Edema forms in patients with chronic kidney disease for 2 reasons. Either it could be heavy loss of protein in the urine or an impaired kidney function. Nephrotic syndrome is defined by a significant loss of protein in the urine along with the edema. A decrease in the protein in the urine is the albumin. In the blood it results in the reduction of the fluid in the blood vessels. The kidney then detects a decrease in the blood volume and attempt to retain the salt. As a result of it, the fluid collects in the tissue, resulting in edema. Pedal edema can also occur when someone stands or sits in the same position for an extended period. The symptoms of pedal edema or symptoms include swelling or puffiness of the tissue beneath the skin, skin that is stretched or shiny, skin that retains the dimple or pitch after being pressed for several seconds. Let us take a look at the way to reduce the pedal edema caused due to chronic kidney disease. So what are the treatment that we give for edema? Treatment includes addressing the underlying cause, low salt intake and in many cases causing a diuretic to eliminate excess fluid. It may be beneficial to also use the compression stockings and or to elevate the limbs. First is reduce the salt intake. Edema can be increased by sodium intake, which in present is a table salt or is a processed food. Reduced salt consumption can help in minimizing edema, especially if you are on a diuretic. Use of diuretics. What are these diuretics? Diuretics are drugs that induce the kidney to eliminate more water and salt, hence reduce the edema. Because eliminating too much of fluid can cause drop in the blood pressure, it can cause headedness or fainting and cause to the further damage to the kidney functions. Then diuretic administration must be used with the cautions. After using a diuretic, you may feel or to empty your bladder more often or more regularly. However, when diuretics are used more prescribed dose, other adverse effects are infrequent. Finally, is the compression stockings. It's the application of the compression stockings to the legs so that it compresses the fluid into the circulation so that the edema can be reduced. These compression stockings we usually advise when the patient is mobile, and we ask them to remove the compression stocking when the patient is taking bath or when he is sleeping. Finally, about the body positioning, we usually advise the patient to elevate the limbs over the elevate by nearly for 30 minutes for 4 to 5 times a day, so that the edema of the feet can come down. Additionally, elevating one limbs multiple times a day may not be feasible for individuals who are working. Lastly, it is not always to prevent chronic kidney disease. Controlling diseases like blood pressure and diabetes on the other hand can be very beneficial. If you are at a high risk for chronic kidney disease, you should get your regular blood test done. Early detection of chronic kidney disease can aid to slow its progression. Limiting salt intake, choosing food with low potassium, and having good physical activity can help in reducing the pill edema caused by chronic kidney disease. Thank you.